Hello, I'm a doctor, gynecologist and fertility specialist Inna Sapozhak. I have been using cellular technologies in gynecology for 7 years. With the help of stem cells or platelet mass, we can treat diseases such as craurosis valvae, atrophic changes in the vagina and vulva, chronic inflammatory processes of the vagina, which are not treatable by using drugs. Recently, our clinic has been engaged in the restoration of the endometrium using our own endometrial stem cells. At the moment, this is a very relevant topic in reproductive medicine because surrogacy is prohibited in many countries and most women want to carry their own pregnancies. Now I will try to explain why I mentioned surrogacy and endometrium here. To make it clear to everyone, I mean colleagues who do not have a medical education, I will switch to an ordinary language. The uterus, fallopian tubes, ovaries are all reproductive organs that are necessary in order to conceive and bear a child. Every organ has its own structure and each cell performs its own special task. After fertilization, the egg begins its active dividing and moves along the fallopian tube towards the uterine cavity. At the same time, the endometrium, mucus, develops in the uterus. Microvilli, pinopodia, and biologically active substances are formed in the mucosa. Biological substances help the egg to stick the mucous membrane and the microvilli capture and hold it. Then, certain physical, immune, and chemical reactions contribute to the normal pregnancy and childbirth development. Some women can have the uterine factor of infertility due to the absence of a normal mucous membrane that is able to accept a fertilized egg and begin a pregnancy. Surgical of the uterine cavity, inflammation processes, or hormonal disability can lead to a violation of the normal endometrium formation. Trauma to the uterine cavity or inflammation contributes to the formation of a scar tissue with no endometrium. No endometrium, no possibility for an egg adhesion. Also, endometrial cells are not able to perceive hormones. Therefore, they divide incorrectly and do not form microvilli and biologically active substances that promote implantation. The usual treatment for these cases is antibacterial or hormonal drugs, as well as surgical removal of scar tissues. Unfortunately, these methods are not always effective, and so women are offered surrogacy. We propose to grow the patient's own cells and transfer them to the uterine cavity. Let's go over how do we grow endometrium from a patient's own endometrial stem cells. Using a special tool, we collect endometrial stem cells into a special tube. We forward this test tube to a biotechnologist and they grow the endometrium for 3-4 weeks. During this period, the woman is preparing for endometrial transplantation by selecting hormone replacement therapy or anti-inflammatory treatment or physiotherapy. Such a preparation is individually for each patient, depending on the disease. When the endometrium is cultured in the laboratory, the woman is invited to the clinic for cell transplantation in the uterine cavity. It takes from 10 to 20 minutes, and after 2 hours, the woman is able to come back home. She arrives on the scheduled day for the embryo transfer. This technology allows to carry your own baby without the help of replacement mothers. First, women do not break the law in countries where surrogacy is prohibited. Secondly, the regeneration of the endometrium is much cheaper than surrogacy. Thirdly, decreasing a chance of development of psycho-emotional disorders due to a physiological inadequacy to bear and give birth to a child on her own. The success of our approach is, first, in the detailed diagnosis of each clinical case and confirmation of the diagnosis. Second, personalized approach to each patient. Third, the use of autologous endometrial stem cells that are hormone sensitive. I'm very excited that we give women a new chance to bear their babies by themselves and deliver desired happiness in families. That really makes me motivated. Thanks for your attention.